Now, we are going to be talking to another person, this time around a doctor. His name is Dr. Benjamin Olowo-Jebutu. He is the Executive Director and founder of Benjamin Olowo-Jebutu Foundation, driven with love and compassion for indigent folks in Nigeria. You're welcome on the show, sir.
Thank you for having me. Good morning, beautiful ladies. You guys look amazing.
Merci beaucoup.
Thank you.
We've heard a billion things. I mean, there are myths out there. There are things that are true. There are things that are factual. There are things that are not. But you hear people say ectopic pregnancy is cryptic pregnancy. So we want to know what is what? What is an ectopic pregnancy? And is there anything like cryptic pregnancy?
And that's a fallacy. Don't mind them. They're all just taking people's money.
Okay.
So ectopic pregnancy, ectopic outside. It means outside. It's a pregnancy that happens outside the uterus, outside the womb.
Okay.
Ectopic, outside.
Okay.
Basic. So what happens when there is the sperm goes into the woman, the eggs are released from the ovaries into the fallopian tubes. And that sperm finds its way to the fallopian tube and fertilizes the eggs and forms an embryo.
All right.
So the embryo stays in that fallopian tube for about 24 hours. And for about 24 hours to 4 days.
Okay.
And now flows into the endometrium to now where the baby now starts forming. So if peradventure there's a problem, and it just stays at that fallopian tube, it doesn't get into the uterus, it becomes an ectopic pregnancy. So it can be on the tubes, it can be in the abdomen, it can be anywhere, but it is formed outside the womb.
Okay.
That's called ectopic pregnancy. And those pregnancies are not good pregnancies because they're not in the womb.
Okay.
A pregnancy is a full good pregnancy when it is implanted into the uterus. That's when it's good. That's when it can grow, it can be nourished. Okay. But when it's on the tube, it's either it ruptures or it becomes a problem. We'll get into the symptoms and signs very soon, but that's basically, cryptic pregnancy is a fallacy. There's something like that. People just want to use evil stuff to help, to do this stuff. I in part of eastern part of Nigeria, there's a lot of money spinning thing people are doing. So you know what they do to them? So they give these women some progesterone injections and some estrogen injections.
Those are hormone injections?
Yes, into their vagina, into their cervix. And because of the side effect of those, because they give them high doses, it bloats up their tummy, so they look like they're pregnant. So when they now take them, after like 9 months, they now take them to a particular place and do a CS for them and give them another person's baby. So they have these young girls they're using to make babies for them. So it depends on the kind of money you pay to them. So they now give you what kind of baby they want to give you. So there's not like cryptic pregnancy. It's a fallacy. We need to start educating people clearly about it. Do you know, even very learned professionals that go in there, it's amazing that people don't ask questions. Why would you inject me with an injection and there's no copulation, there's no love making me and my husband, and I get pregnant? Am I Holy Mary, Mother of God? No, it's wrong. It's impossible.
Okay.
Very impossible. Okay. So they're not like cryptic pregnancy.
Thanks for that clarification.
Thank you. So this ectopic pregnancy, what causes it? Aside from you've explained the cycle.
Yes.
So what are the things that
cause? Excellent. So if you have an ectopic pregnancy before, you can have another one.
You can or you can't.
You can have another one. So it's familial. So you have somebody that has cancer in the family, you can have it again. Or you've had a breast lump, if you can have a breast lump again, that kind of stuff. Then you have people that have a lot of infections. Pelvic inflammatory infections can have that. People that have had previous surgeries can also have ectopic pregnancies. I get to me people that have that take a lot of fertility medicines. Okay. Where the fertility medicine can help them have a lot of babies. So those babies can be formed outside the womb, but they can have ectopic pregnancies too, basically. So those are the things you should look out for in having a ectopic pregnancy. So people that do a lot of additions in their womb following evacuations, D and C and stuff like that, are also prone to having ectopic pregnancies.
Let me understand the last point you just made.
People have had additions. Additions formed in the womb. So instead of the embryo coming into the womb, there's no space because of additions. They stay on that tube because they've had a lot of evacuations and D&Cs growing up. Having a lot of abortions, habitual abortions. They're also prone to having ectopic pregnancies.
Okay. So you did say at the beginning that an ectopic pregnancy is a bad pregnancy. Why?
Very bad, yes, because so the way God made our body is that the only place that can take a baby is the womb.
Okay.
So if there's any baby or any embryo outside the womb, it can cause the deformation of that organ, which means, I give an example. So somebody has a baby or an embryo on the tube, maybe left or right. Most of the time they're always on the right tube because the right tube is a bit tilted a little bit to the other side. So on the right tube, yeah? And most times it ruptures. So if you don't see them on time, if you're having some pain on your right side, you're feeling very lightheaded, like you're feeling very dizzy sometimes, dizzy spells, and you don't even know you're pregnant. So you go on to a PT test, before you get pregnant, you do a scan, I say, there's a pregnancy. If you're lucky enough, it hasn't ruptured, you could have medications to take care of it. But most times people now know this thing when it's an emergency, when it's ruptured, when they start having bleeding, they start bleeding very heavily through the vagina and severe pain. The pain is markedly severe on one side of the tummy. So you just press the tummy, they're like, whoa, shout. That's the other kind of thing they have. So because the baby has to grow, when it grows on the tube, what happens? The tube cannot take the baby, it ruptures. When it ruptures, that's a lot of bleeding, and that's why it's a bad pregnancy.
Because that
so it becomes an emergency.
Okay, that brings me to, you talked about when they know.
Yes.
So at what point does an ectopic pregnancy start showing?
So that's why people should go for a regular checkup. You should go for a regular checkup. People should go for a regular. You miss a period, go check, do a test. If you miss a period, 1 month, go check, do a scan, then do a PT test. So if you're pregnant, by the time I get into about 6-7 weeks, and you start having the symptoms, pain in the tummy, some kind of form of spotting through your vagina, some kind of lightheadedness and feeling very, very fainty sometimes, you go get checked. That's like mild symptoms. So when it becomes severe, if you don't get it checked, and it becomes like you're now bleeding through that rupture, at that time, some people come to the hospital faint, or already fainted, already almost dead because they've bled a lot into the abdomen. That thing can bleed so much. Yeah. So that becomes an emergency. But if you detect it early, maybe like before it's ruptured, you could curb it. There are drugs to take to curb it and just nip it in the bud and just make it grow again, and the body just absorb that embryo. Okay. But most times in Nigeria or most times in Africa, people don't know on time. So they're coming in an emergency. You have to do a laparotomy to them. And
what's the laparotomy?
Laparotomy means open up the womb, open up the abdomen, look for where it's bleeding from, and ligate it. So that's why a lot of them lose that tube most times when you ligate it, because you have to close the bleeding and take out that bleeding part because it's no more functioning.
When they lose the tube, it means it limits their chances of fertility?
Yes, and it means they can also have an ectopic pregnancy on the right again.
On the right again? On
the next one again.
So the question is there, because let's talk about a myth now. I've heard a myth before that there's some certain persons that get ectopic pregnancies and they still face it out and carry to term, and they give birth to
that's not true. Don't mind them. But another myth.
So it's not possible at all to carry.
So there's no way that medication can shift that embryo into the womb.
See, so we need a lot of education, information, and clarity of purpose. Because what would help us in this part of the country is the right information.
Yes.
So everybody gets the right information very well, clearly.
Yes.
I believe in God perfectly, but there is no ectopic pregnancy that will grow and it will transfer into the womb. No. If it's ectopic, it means outside the womb. It's already ectopic now. It's already outside. Only babies in the womb are permitted to grow.
Okay.
And function well. You know why? Because you have to feed the baby. And where do you get feeding the baby from? From the womb. The placenta is part of the womb and is connected to the baby through the umbilical cord, that it is in the womb, not outside the womb. So don't mind them. A lot of them lie. I've heard stories of people that they will say they're going to do they're going to get babies in one part. I won't mention the name. One part in the other state, and then they come and share testimonies. Apparently, so these guys have like a bunch of ladies, young ladies that make babies for them. So they now travel away from where they're located from Lagos. They're there for like 9 months. They said that they went to deliver the babies, and they now come back home with babies. Most of the time, a lot of them don't know what babies' genotypes are. So this lady had a very good testimony in church. I said, yeah, she has a baby. She didn't tell them how the baby came. Guess what? The 2 kids she had that they gave to her were sickle cell anemia patient babies. And she and her husband, they are both A and A. So how did you get that baby? You know, so it became wow, you can never have an excess child. So that's why they started knowing that, okay, they go to buy the babies. Yeah, so it's important people are informed. People don't lie to people. Yes. You know, I know miracles happen, but be clear. Okay. What process did you go through? Okay. So people can know that it's not a magic. You have to go through some processes. They were clear about the indications.
Okay, so that's a myth debunked.
Yeah.
And we've talked about causes. You've mentioned the symptoms, I believe.
Yeah, I mentioned some of it. So most of the symptoms are so from moderate to very severe. You know, moderate, as I said before, mild headaches, lightheadedness, you know, pain on the right, but not very severe. Sometimes spotting. But when it becomes very severe, there's heavy bleeding from the vagina. There's a lot of bleeding into the abdomen. They're faint. There's collapse, low blood pressure, very heavy dizziness, fatigue, and everything just looks very, very bad. It becomes an emergency. So at that point, they need an urgent laparotomy to save their life. Okay. Not even save their tube. So their tube is even secondary. At that point, the secondary is they can bleed to death that way because there's like a tap. It's like a tap opening into the abdomen. That someone can get this baby because it just keeps bleeding until you just go into the theater and arrest that bleeding and take out that tube. They don't survive.
So I need to understand this.
Talk to me.
If it's an embryo that has not fully developed, how long does it take to, one, find out it's an ectopic pregnancy? Or how long does it take for an ectopic pregnancy to rupture? So
between 8 and 10 weeks, you know. Between
8 and 10 weeks is about 2 months
about 2 months and a half,
okay, but you start having symptoms from 6 weeks.
Yeah, from 6 weeks. So you're pregnant about from 5 weeks. You know you're pregnant from 5 weeks. So when you start having those spottings, those things, maybe 5-6 weeks, go get it checked. If at that point you do a scan and they know it's ectopic for you, you can take a drug called methotrexate. You know, it's an injection. It's a drug that what it does is to just regress the growth of that embryo and make your body absorb it. Okay. You get me? So there's a baby growing.
So it's not going to be like a miscarriage?
Yeah, no. Baby just like a miscarriage, yes, but baby just gets absorbed in that body and you don't rupture the tube. At that point, the tube is salvaged because you knew early. But if you waited about 8 to 12 weeks, at that point, baby has grown bigger than that tube, then you can rupture. At that point, you need to do a surgery.
You still can't do the
injections, no.
If you didn't...
no more.
So sometimes, if 2 things can happen. If it's less than 8, maybe about 7 to 8 weeks, you could do laparoscopy, which means you just put a small tube into the navel and try and take out that ectopic if it's not ruptured.
Okay.
Yes. But most times, as I said before, people don't come in early. They come in when it is ruptured because we don't have a very good health-taking behavior in Nigeria. We don't go check stuff. We just, oh, praise God, I'm pregnant. Nobody goes to check it. Yeah. How do you know you're pregnant? I had a dream. I lost my baby. You know, that kind of stuff. So it's important we get it checked.
When you eventually take it out by these surgeries, these procedures, and the injection you've talked about, are there side effects afterwards?
So you can't have another ectopic pregnancy.
Later on.
And obviously it reduces your. So somebody has, you have 2 tubes. You don't have a baby. You now have 1 tube. There are less chances, you know. But we've seen a lot of people, a lot of miracles. A lot of people have had more kids with that. A lot of people have seen loads of women, you know. So that shouldn't deter you from having more babies. But you should try and prevent infections. Try and prevent taking too many fertility drugs. Then don't do a lot of abortions again, you know. So if you can take care of those areas, you might not have an ectopic pregnancy.
Is an ectopic pregnancy preventable?
That's what I'm saying. Those are the preventable things you should do. Make sure you're very, very clean. You don't have STIs. You know, maybe you have a boyfriend, or you have a boyfriend or somebody you're dating. Use a condom. You know, try and be careful. Kind of toilet you use. You don't have infections. You don't have PIDs, UTIs. Be careful. Then also don't try not to do abortions. You know, because abortions, when there's a lot of evacuations, it causes additions in the womb. And so the baby stay in the womb, baby cannot stay because there's addition. There's a blockage. The additions are like blockage. Then they stay on the tubes. You know, if you can prevent those kind of things, you will not have ectopic pregnancy.
Okay, so I'll take it from your last point.
Go ahead.
How much is too many abortions? Because I know that there are some people listening or watching right now who would start getting fidgety that, okay, so is it one abortion, two abortions, 5, 10, 7 abortions?
So you don't say numbers of abortions.
Okay.
One abortion can kill you. One can be crazy. It can be done by a quack, or can be done rigorously and can puncture your uterus. So it's not about your number. It's about the skill. It's about the person doing it. Why are you doing it? What are the other comorbidities the person has? And the person has maybe an ovarian cyst. The person has maybe or other is diabetic or have low blood pressure. And there are other things that can complicate your abortions. So why are you doing it? You must ask yourself, why am I doing this abortion? So if I'm going to get pregnant, why don't I use a condom? Why don't I use pills?
Preventive,
Why don't I prevent it? So if you're not ready for the baby, then don't get pregnant.
Is there any?
Are you getting my point?
I do.
So you cannot say it's a number of times. People get it wrong that way. Some people have done just one abortion and they've lost their whole womb. Yes, just one.
Yes.
Because the guy that was doing it just went straight into the uterus and went out of the uterus and just punctured it, and that just made them have what we call a ruptured uterus, and that was. And they had to do what we call an hysterectomy, take out the womb. So it's important people know why. So, but there's something called medical abortion, which is miscarriages. So somebody is stressed from work, or somebody took a bad drug that killed the baby, that aborted the baby. Those ones are medical abortions, and they're done probably by doctor properly. You know, they're sedated, they're arrested, they examine properly, do a scan for them, then they're done well. Those ones are medical abortions. But most times, people in Nigeria or Africa or all over the world do what we call habitual abortions. They love to do it. So it's like some of them is like their thing. You know, I'm just going to take it out. I'm just going to take it out. I'm just going to take it out. So they keep doing it because it's an habit. So we call it habitual abortion. So they keep doing it, getting pregnant, keep doing it, and sometimes one day they'll be no luck again, and that time there's no womb anymore.
Okay, so the medical abortions, the ones where you take the drugs and then maybe you bleed out through miscarriage, do those ones also increase the chances of having an ectopic
Definitely,
pregnancy?
yes. Okay. Definitely, yes. Every abortion increases the chance of having an ectopic pregnancy.
Okay.
Then taking a lot of fertility drugs too. So you have a lot of fertility drugs, even when they're naturally fertile. They're very naturally fertile. They're fertile people, but they still want to, you know, they Google or they ask their celebrity friends in court, what can I take to get more babies, you know? And they start taking these drugs, and these drugs just makes them start having, prone to having ectopic pregnancy. People that have a lot of infections, you know, pelvic inflammatory infections can have that. People that have had previous surgery.